So, you've just left your doctor's office? They dropped the phrase lumbar puncture, and suddenly the air in the room got sucked out, didn't it? It lands with the same delicate thud as an IRS audit, or "we need to talk." Your friends look at you with pity. Your family starts whispering. A quick trip down the Google rabbit hole reveals horror stories that would make Stephen King say, "All right, dial it back." It's become the medical equivalent of Voldemort, the name you don't say. But let's be absolutely clear. A lumbar puncture, or more dramatically, a spinal tap, is not the villain. It's not a scene from the movie Saw. It's a diagnostic test. Quick, routine, kinda boring. Doctors use it to solve real medical mysteries, like looking under the hood of a noisy car. Yes, it can be intimidating, but it's often the fastest way to find out what's wrong and how to fix it. Take a deep breath. Let's dismantle this scary reputation piece by piece. People imagine a giant needle, a lifetime of pain, a high-stakes game of medical roulette. The truth? Done thousands of times a day, safely and effectively. The fear? Mostly myths, misunderstandings, and an ancient anecdote from your aunt's cousin's neighbor. Medicine's changed since disco and bell-bottoms. This is your guide to separating facts from folklore. We'll walk through it together. First things first, let's talk cerebrospinal fluid, CSF. Think of CSF as your brain and spinal cord's personal entourage. It's a clear, watery cushion, a shock absorber, and a delivery service all in one. If your brain were a celebrity, CSF is security, nutritionist, and waste management, protecting you from curb trips and overachiever sneezes. It's constantly produced, circulates, then gets reabsorbed. A beautiful, self-sustaining system. About a pint per day, always fresh. In direct contact with brain and spine, it picks up valuable info. It carries waste products away, collects chemical clues, stray cells, and markers about nervous system health. It's basically the brain's private Twitter feed. A lumbar puncture is how doctors read the tweets. They're not draining brain juice. They borrow a thimble-sized sample your body replaces in hours, like sampling a river. CSF is a liquid diary from two places hard to inspect directly. The goal isn't to mess with your spine, it's to access this incredible info source, pristine fluid where unexpected guests stand out. So, why would a doctor do this? Are they just fans of pointy objects? No, probably not. Most common reason, detective work in the central nervous system. When symptoms suggest CNS trouble, severe headaches, numbness, weakness, cognitive changes, an LP can reveal clues other tests can't. It's useful for inflammation and infection, often invisible on MRI. For example, multiple sclerosis. The immune system attacks myelin. MRI may show lesions, but the LP provides the forensic evidence. Doctors look for oligoclonal bands, like fingerprints suggesting MS. LP is gold standard for meningitis, can detect encephalitis. Time is critical, and LP rapidly distinguishes bacterial versus viral to guide treatment. It also helps diagnose rare autoimmune disorders, cancer in the CNS, and normal pressure hydrocephalus. Think puzzle. MRI gives the picture on the box. Symptoms are scattered pieces. The LP provides the crucial corner pieces, the biochemical reality that confirms or rules out suspicions and moves the case from guesswork to diagnosis. First, you'll go to a treatment room. Disappointingly sterile, not a gothic dungeon. The team is calm, just another Tuesday. You'll change into a hospital gown, a humbling fashion statement. Two classic positions, curled on your side like a shrimp, or sitting, leaning forward over a pillow like confessing a secret. The fetal curl, the cat stretch. Both open the lower vertebrae spaces. A nurse cleans a small area with cold antiseptic. It's the medical equivalent of wiping the counter before cooking. Use the moment for deep breathing. Next, local anesthetic, a sharp pinch or quick bee sting. Not pleasant, but over fast. Once it kicks in, you should feel pressure, not sharp pain. If you do, say so. They can add more numbing. Then the main part begins. You'll feel pressure. They're not lying. A thin needle is guided into place. You might feel a weird electrical twinge or brief cramp if a nerve root brushes. Normal and temporary. Stay still and keep breathing. Collecting the fluid takes only a few minutes. It drips, not gushes, into small numbered vials. They may measure opening pressure, a valuable clue. The whole thing is quiet and anticlimactic. Gravity does the work. Popular imagination. Once the vials are full and the needle is out, bandage on, the hard part is done. Congratulations, you survived. Most places have you lie flat for 1 to 2 hours to help seal the site and reduce headache risk. Catch up on podcasts, enjoy medically mandated quiet time. Then you can go home. Take it easy for 24 hours. Not the day to run a marathon, move a piano, or crush a gym PR. Rehydrate and relax. Drink plenty of fluids, water, juice, whatever you like. Best advice, caffeine. Coffee, tea, soda can constrict vessels and prevent or treat mild post-LP headache. Your doctor is literally prescribing a latte. A sore lower back is normal. Acetaminophen usually handles it. Know the difference. A post-dural puncture headache is positional. Worse sitting or standing. Much better lying flat, often throbbing in the front or back of the head. If you get that severe positional headache, don't be a hero. Call your doctor. A quick epidural blood patch, your blood seals the leak, often brings immediate, profound relief. Simple fix for a miserable problem. So, you've done the deed. Tiny vials of CSF are off to the lab. What are the scientists looking for? It's not a microscope sign that says MS here. It's a multi-part investigation. First, appearance. Healthy CSF is crystal clear. Cloudy can mean infection. That's white blood cells swarming. They count red and white blood cells. A few red cells may be from a tiny nick. Elevated white cells are a big clue. Neutrophils point toward bacterial infections. Lymphocytes suggest viral or autoimmune processes like MS. Chemistry panel, protein and glucose. High protein suggests inflammation or infection when the blood-brain barrier leaks. Low glucose is classic for bacterial meningitis. Bacteria eat the sugar. Comparing CSF to blood glucose shows if something is consuming sugar. Advanced tests for MS include protein electrophoresis to find oligoclonal bands, antibodies in CSF but not blood, proving an immune response inside the CNS. Other tests look for viral antibodies or culture infectious agents. Each result is a puzzle piece. Together, they give your doctor a remarkably clear diagnostic picture. So, here we are. What's the big, shocking takeaway? The shocking truth is, there is no shocking truth. A lumbar puncture is not a horror movie or a barbaric ritual. It is safe. It is routine. It is incredibly useful. Pre-procedure anxiety is human, and almost always disproportionate to the brief weird reality. For most, it's minutes of discomfort in exchange for a world of clarity. That's the real story. It ends diagnostic odysseys, confirms or rules out scary possibilities, and helps doctors make a plan so you can move forward. No, you won't be paralyzed or leak forever. You'll feel a sting and some pressure, lie down a bit, then go home with a bandage and a prescription for coffee. In a few days, that little vial might hold the key to your future. If this helped, hit like, subscribe for the next episode. Blood tests, the underrated detectives of MS care. Comment, which scary-sounding test turned out to be no big deal?